Yeah, that was good, right?
Take it away. Yes, almost rhyming there. There must be something going on in the studio this morning. It's either rhyming or it's dancing. Yes, Health Today brought to us, as always, and we having a focus this month on cancers. Dr. Totimeh, our resident consultant neurosurgeon, decided today we should look perhaps at ENT cancers, ear, nose and throat cancers. Say good morning to you, Dr. Totimeh.
Good morning. Good morning.
Good morning to you.
Yeah, I thought it was really important because ENT cancers are not, thought about as often. We don't see them, so we don't think about them, so it's important. But I also thought that a discussion on the science of cancer was really important. We've talked about cancer, we've talked about origins, but I thought that somebody who's doing her PhD in cancer,
who better to turn to than
for us to think about our environment and what carcinogens are, and so at this point I keep quiet and then
we'll expect you to chip in a little bit later on. But welcome to our two new guests in the studio. We have with us Kafui Searyoh, who is a consultant ear, nose and throat surgeon, rhinologist and endoscopic sinus surgeon, my word. And he manages to find time, he does this all at Kolebu Teaching Hospital, but manages to find time on the side, as one does, to be a senior lecturer at the University of Ghana Medical School. And we say good morning to you, Kafui.
Good morning.
Lovely to speak to you on the Asaase Breakfast Show. And then the lady, the said person doing her PhD in matters of cancer research, is Seyram Doe Tetteh. And say good morning to you, Seyram.
Good morning.
Lovely to see you both in the Asaase Breakfast studio. But quite a serious matter, perhaps partly triggered by a conversation that Dr. Totimeh and I had on the sidelines, as he always has these interesting, very on the sidelines type conversations about the sort of week he had, was it last week, where he had to perform emergency surgery, usually at about 5 o'clock in the morning, because he claims that's when specialists such as himself like to schedule their cases. But 2 cases of the 3 emergency surgeries he performed, 2 involved young people who presented with sinus problems, which turned out to be a cancer problem. I wanted to ask you, Dr. Searyoh, I was disturbed.
Infective problems.
Pardon?
Infection
problems, which were signs or symptoms of a much deeper problem. I wanted to ask you, Dr. Searyoh, in your practice, one is the thing of people presenting, I understand nasopharyngeal cancers are the most common kinds of ENT cancers you come across. Explain to us, first of all, what a nasopharyngeal is. That means your nose and your pharynx. What's your pharynx?
So the pharynx is basically the anatomical area that is located behind all the orifices in front of our face. So we have the nose, so the pharynx behind the nose is referred to as the nasopharynx. So in the throat, which is the oral cavity, the pharynx behind the oral cavity is referred to as the oropharynx. Oropharynx, yeah.
Oh my God.
And then in front of our neck, where we have the Adam's apple, that everybody refers to, also as another pharyngeal layer, then that cavity is referred to as the laryngopharynx, or commonly the laryngopharynx. Larynx means the voice box, which is the Adam's apple. So the pharyngeal space behind that particular area is referred to as the laryngopharynx. Now, coming to the nasopharynx, is just the space behind the openings in our nasal cavities.
Your nostrils.
The nostrils. So during the time of COVID, they used to pick all these swabs from the back of the nose. So if you see how deep the probe goes in there to pick the sample, that area is actually where they were targeting to pick the samples from those areas. And any cancer growing in that space is what is referred to as a nasopharyngeal cancer. Yeah.
Now, a lot of the cancers that we've spoken about here on the Asaase Breakfast Show are things very deep in the body. We talked a lot about breast cancer. We talked about cancers of the stomach recently, gastrointestinal problems, and so on. You talking about these things which are behind these cavities, or if you like, openings to the body, seems to suggest that somehow there's some relationship between environmental factors or invasion of the body and the development in these cancers, or is that me just, kind of imagining things?
Yeah, so that's exactly what it is. So actually the development of these cancers in this, what we call hidden areas, these areas, unlike the breast, which is quite exposed, when there's anything going on wrong with the breast, you can easily notice it. But then in the anatomical areas I just described, the nasopharynx, the oropharynx, the laryngopharynx, it's quite difficult to find out if anything is going on there until there are manifestations that are external. So, like you said, the etiology of most of these cancers is a combination of a genetic predisposition and then the environmental factors that we have.
Right.
So, for the head and neck cancers in general, your predispositions are maybe genetic. So probably if anybody in the family with a particular kind of genome, which I'm sure Seyram would highlight on, has had a cancer, then you are likely to probably develop that. But that's difficult to sometimes investigate. Then the most important factors are the environmental ones, which we can have some control over. So one is viruses within our environment. So there's this particular virus called the Epstein-Barr virus, which is quite common. We've seen along the coastline of Ghana, seems to be quite common. That's one of the main viruses implicated. And then we have some habits like smoking, alcohol intake. And then for nasopharyngeal cancer in particular, those who take salt preserved fishes. If there's fish, yes, that
salt
is
fish.
Yes, fish that's preserved in salt, you stand a risk.
Oh Lord, this is not turning out to be a happy morning. But this is where perhaps I should ask you about the importance of the associated risks. So, for example, you spoke about the virus that's very common along the west coast of Africa. Is it, again, has the science got far enough that it's shown to have a causal effect, or is it more a case of it's associated? In many cases where you find people with nasopharyngeal cancers, you will also find the presence of the virus.
So we've actually done some work on this, and then it shows quite a big prevalence of the disease, of the virus carrying rate in along the coastline or in our population. Now, when you have these viruses, they may produce various genetic mutations within. So depending on the particular subtype, here I think we found 2 types of the virus down here, and depending on which one you have, may predispose you to getting the cancer. So the fact that somebody has the virus within will not particularly mean that you are going to develop the cancer. But the interplay with environmental factors may then speed up you getting this. I must also add that this virus is in specific relation to the nasopharyngeal cancers. But for cancers of the throat and then the voice box, we have other viruses like the human papilloma virus.
Oh, again.
Yeah, which we find in cervical cancer. But just that the subtypes that cause the cancer within the voice box is quite different. And also in the oropharynx or in our throat, the throat cancers also, some forms of the virus has also been found. Also HPV, but this time the subtypes are 16 and 18. So a few behavioral patterns within the community may also contribute to some of these cancers, especially if you have a partner who is carrying this virus and you are engaged in oral sex, then we stand a big risk.
That's where that
of having this problem. And the other developing pattern we are noticing among the youth in the population is the use of shisha. people assume shisha is not cigarette, but then it's been shown or it's been demonstrated that its effects are as much as cigarette smoking could also cause to causing cancers in these anatomical areas in the head and neck region.
I'd love to come to Seyram next and talk very quickly, talk to her about the science of cancers and some of the research that you've been speaking about. But does vaping have the same effect?
Yeah, it does.
Seyram is nodding vigorously.
Yeah.
Seyram, tell us again. Nice, bright, young-looking woman like you. It sounds like a very grim subject to which to turn your mind, but of course you're doing research which will no doubt benefit all of us. You're particularly studying PhD. In which year of your PhD are you now?
So this is my first year, but I have been doing cancer work for the past 6 years.
Wow.
Yes.
Okay. And I take it by your very cultured Americanifying tones that you are actually also partly resident somewhere else other than Ghana.
Yes. So I am Ghanaian American.
Right.
My parents are Ghanaian but American background. But I like being in Ghana and I like coming back quite often. And I feel like with the rise in oncology research going on the continent now, this is a good place to be, especially for my work. So.
Right. So you're doing part of your research, at least here in Ghana.
Yes.
And talking about what Dr. Searyoh mentioned earlier on, the kinds of research that are increasingly finding links between certain viruses and particularly genomic subtypes of viruses and the incidence of cancer in this disease in relation to ENT cancers. Have you come to the field and found it's completely virgin territory, or has there already been a basis of some good public health research work on which you're now building your own research?
So my work is in an entirely different form of cancer, but I have knowledge about what Dr. Searyoh has mentioned. And one thing he mentioned that I think is very important to understand is that there is a certain mutation called EGFR. And
EGFR.
And if, let's say someone has a nasopharyngeal type cancer and they have that EGFR mutation and they have been smokers, they are less likely to respond to immunotherapy or targeted therapy.
Oh, wow.
So this is something that I think everyone has to keep in mind, especially for younger people where vaping has now become such a huge thing. And he also mentioned shisha, which is also, at this point, I think is a public health crisis, and a lot of work.
Feel that?
Yeah, I think a lot of work should be done into that area because we've seen young people and a rise in vaping, and we've also seen a rise in younger people being diagnosed with different forms of cancer due to these kinds of behaviors.
And shisha being particularly, of course, popular amongst women. It's a very sociable thing to do. You'll gather around at a weekend. You think you're sharing something that is pleasurable, and you're socializing at the same time. Extraordinarily disturbing. And if anybody needed any kind of indication that smoking is a bad idea, well, we have our own smokers in house. The least said about which, the better. But you speak about your own particular area of research. Which cancer are you actually specializing in research?
So it's a gynecological cancer called female germ cell tumor, and it's very rare. But we are trying to study the tumor genesis of that disease type, how it starts, what mutations drive this disease type, and for me particularly, I'm trying to get more black samples to be able to see if there are differences in mutations or differences in each ethnicity responding to the different immunotherapy or treatment provided for this cancer type.
And Dr. Searyoh spoke there of the interaction, the interplay between genetic predisposition, certain types of unuseful behaviors, and environmental factors all coming together to make you the possible target for this disease to develop. Now, of course, coming from the United States, there's the internal politics of your own medical research, I'm sure, in the United States, to do with races and access to public health services. But tell us how it plays out in the world of research into the science of cancer. You presumably don't lack for willingness of people to come forward to offer themselves as subjects of research. But is the funding readily available for you to perhaps look at, say, global African populations in the United States and their specific cancer research needs?
I think this question is amazing, and I'm glad you asked. With the current political climate in America and with everything that's going on, with funding being cut into a very important subject like cancer research, it's becoming harder and harder for the work to continue, because right now everyone is anxious about where they're going to get the money to continue doing the work. And I think for my work, we have seen a larger sample of like white patients and some Asian patients, but not necessarily for African American or Black samples. And that's because there's a distrust of the healthcare system. And I think ultimately, I like the work that Dr. Totimeh and Dr. Searyoh have been doing, because they provide a safe space for patients to come and to actually be seen and know that they have a doctor on their side to help them navigate the process when it comes to oncological care, and I think that's something that honestly we are lacking in America. And there's a rise in representation of Black doctors and Black scientists. So hopefully in the next few years, this would be something that would grow and that distrust of the medical system would stop. But with the current political climate, I'm not sure when that would be.
Well, question mark. And that's just talking about attitudes towards the healthcare system. Then there's the whole added factor of money and access to medical insurance, I'm sure, that comes up in relation to your research work. But coming here to Ghana, you're based where in the United States?
New York.
In New York, at
Yes.
New York University?
Yes.
Okay. And when you come here, do you base yourself mainly at Komfo Teaching Hospital, or how do you do your research work?
So I've currently been working with people from Pathology Without Borders, but thanks to Dr.
There's a
Totimeh.
Pathology Without Borders as well. My word. Yes, it goes on and on. Yeah, okay. Right.
So thanks to Dr. Totimeh, hopefully, fingers crossed, I would be working with some people from Kolibu and a lab here in Ghana to officially start my work here within the next year.
That would be fantastic. We'll have our digits crossed for you. I'm sure it'll be a very fruitful collaboration. And coming to some of the research facilities here in Ghana, even if you've not had the chance to work officially, maybe you've had a chance to observe some of the research. What do you make of the efforts being made by doctors who are permanently based here in relation specifically to cancer research?
I think they're doing fantastic work with the resources that they have. They're trying their very best to meet patients where they are. And we cannot also ignore the cultural context, which I think doctors here are doing fantastic work to include that in patient care. And I would hopefully like to see more research done into germline mutations, which are technically inherited mutations for cancer work. And I think a lot of the work being done here are somatic mutations, which are just happen spontaneously or from mutagens, such as what Dr. Searyoh mentioned, like the environmental factors, viral infections and things like that. So I think the doctors here are doing fantastic work with the resources provided.
Now, Dr. Searyoh, if I could turn back to you and asking you, we've heard very encouragingly, very encouraging comments from Seyram Tetteh there. But in your own practice, you're talking about what is a more obscure form of cancers. Yes, you described the more prevalent forms, the nasopharyngeal, presenting more often than most. But what is the in the general cancer landscape in this country? What sort of order of significance are ENT cancers? Do ENT cancers hold?
I think the last time the Radiotherapy Center put their data together, all together, if you take the head and neck cancers, I think we are ranking about third, if I'm not mistaken. Yes, after breast, it seems there's breast, and then there's prostate, and then I think the ENT was, I think, the third rank cancer.
Oh my gosh! So you are talking about a pretty prevalent form of disease.
It's a very the prevalence is high. However, the manifestations are what looks like any other common symptoms. So let's take nasopharyngeal cancer, for example. Should somebody have nasopharyngeal cancer, all he's going to complain of is a blocked nose, a discharging nose, and then you may have occasionally the patient having bleeding from the nasal cavities.
Right.
Now, when we have these symptoms developing in our society, everybody assumes it's a common cold. It's only when there's a lump on the neck that draws the attention of the patient that probably this is more severe than I think. So they would actually come to you with complaints of having noticed a lump on the neck, for which they are presenting, rather than the nasal symptoms, which are early signs. So by the time you have a neck node, it's considered a late stage. So it will be very important for the listening public to take note that should somebody have persistent or progressive nasal obstruction, a nasal discharge with recurrent nosebleeds, it's said that every man is allowed to bleed once from his nasal cavity during his time on this earth. Beyond once is disaster. So that should be investigated. So there's actually a triad: having a nosebleed, complaining of hearing loss in the ear, together with having noticed a lump on your neck. Those three are the three cardinal features for which you should exclude a nasopharyngeal cancer.
But how do you distinguish between an ordinary cold? I mean, most people with a bunged up nose, I know some people say permanently bunged up noses. Is it the duration of what appears to be a cold, or is it the severity of the blockage?
Yeah. So both come into play here. So the duration is important. Okay, if you have a common cold, it's expected that usually by 2 weeks this should have resolved. Anything beyond then that is not responding to the general medications that probably a general practitioner will give you, we have to investigate that. There may be other causes of nasal obstruction during the course of diagnosis, but then for the sake of not missing any cancer, it's better that we would always have this evaluated if it goes beyond a month. The other thing that people could develop is you have a nasal obstruction that rapidly progresses, and like cancer cells, they would rapidly grow. So should you have a nasal obstruction maybe over a month, and then within the next month you find out, no, this is becoming more than usual, you should come over for us to exclude this. But as for the nosebleed, once you see one nosebleed from your nasal cavity, I think that it's worth evaluating. And another point of note is that nasopharyngeal cancer, as we say, has a bimodal presentation in our environment, meaning that you could have it in children and then in adults. So the peak periods we've seen in Ghana between the ages of 7 and about 16 for one peak, and then in the adult peak we have the 45 to about the 70-year-old. So children who have nosebleeds,
7 to 16.
So children who have nosebleeds, we should not take this lightly. One, because children cannot walk to the hospital themselves, parents are likely to disregard their complaints, and that is where we sometimes would have a challenge. So the listening public should really take this particular presentation into consideration. Then for the laryngeal cancers, it's all about voice change. So if you have a change in your voice or you become hoarse, and this hoarseness does not resolve beyond 2 weeks, you need to have a scope passed down your throat to evaluate your voice box, just to be sure. And if you are in the adult age group, that is even much more important than any other thing else.
Right. Because I was going to say, well, if it's a younger person between the ages of 7 and 16, you could say, oh, it's their voice breaking suddenly. I mean, what might signal in a child to an adolescence that a change of voice or hoarseness of voice wasn't the normal thing of the adolescent hormones kicking in, but was something that was a deeper problem? Is it the dryness and soreness of throat lasting long?
Okay, so if you have the hoarseness of the voice, which is progressive, because most people, when the voice breaks, it's usually static. It doesn't just break and continues to break. But then this is classically hoarse. When the person is speaking, it's like you don't actually hear the words very well.
Right.
It's like going to the stadium shouting and then losing your voice afterwards. If this persists beyond 2 weeks, it should be taken very seriously.
Right.
And in that age group, in the pediatric age group, there are other causes of hoarseness. That is also, in which case the hoarseness could still be progressive.
Right.
There may be some benign tumors still in there, but it's still pathologic, so they still need to have their voice evaluated. Now, if you're an adult who smokes, then for you, any hoarseness of voice should warrant an immediate evaluation. Yeah. Now, in a few patients, when you have the hoarse voice, you may have associated pain on swallowing. You may have a pain in the ear, so your voice is hoarse. You find that one ear all of a sudden seems to have some intermittent pain in there. And then at the worst end of the spectrum is when the hoarseness progresses until you have difficulty in breathing. Then sometimes people may manage you for asthma. So with the laryngeal cancers, you are not supposed to have for asthma, you don't usually have a voice change because asthma is a disease of the lower airways. So should you have any presentation like a wheezing feeling together with a hoarse voice, then that should imply that probably there's something happening at the level of your vocal cords. And that could be a carcinoma.
Dr. Totimeh raised his finger. Yes, there you go. Go ahead, Dr. Totimeh.
I just thought, listening to everything, wanted to just raise a point on some work that Seyram's lab did when it comes to exposure to carcinogens. And we've been talking about screening, and the fact that we have to, pick up these things from
as early
screening,
as possible.
Right. But one of her labs did some interesting work in Nigeria where they gave people wristbands, to walk around with. And then after a period, they checked the wristbands for carcinogens. And I'll hand it over to Seyram to see what they found, because
this was where here in the United States, in Nigeria.
It was from her lab in the US.
What did you find?
So a lab at Memorial Sloan Kettering Cancer Center. I work with that lab. The PI's name is Peter Kingham. His work primarily focuses on colorectal cancer. So they went to Nigeria, gave the patients there a wristband that had been put in some solution, and asked the patients to go around for 7 days, and after 7 days returned back to the hospital with a wristband. They then run some tests on it and then realized that patients who had colon cancer had higher levels of several types of carcinogens that comes from like working with coal, burning, garbage, like all of these things that have contributed adversely to their health. And one thing that I think Dr. Searyoh mentioned when it comes to screening is that for most African or Black patients, they present late stage with these cancer types. And that's because, as he stated, they always think it's something else instead of going to the doctor when they discover some early signs. And in Nigeria, they realize that if a patient comes to the hospital with a certain type of cancer and they had lost a lot of weight, it's called wasted. The cancer has wasted them. That means that they are at a late stage in that disease type. And at that point, even if they get on immunotherapy or targeted therapy, the prognosis is bad. So I encourage everyone listening that if you have any of these symptoms mentioned, or if you're in a space where these environmental factors such as a lot of smoke, smoking, burning garbage, all of these things, just to keep those in mind, that can adversely affect your health.
And with all the talk that there's been recently, Dr. Searyoh, perhaps if I could turn to you there, about air pollutants, particularly in settings like Accra, we have no idea what we're breathing in. I remember talking to Professor Nanama Brown-Kluche, the new head of the Environmental Protection Authority, about, it's not even necessarily a particular kind of sort of allergy triggering disease, but just particles in the air, and then exhaust fumes and so on. Has that you found particularly the air, the general environment, air and otherwise, has that had a complicating effect on the way people are presenting to you, presenting with ear, nose and throat cancers?
Well, with regards to the cancers, I was trying to do some small work where I tried mapping the whole country to see the distribution of the various cancers across. That work is not completed yet. But this is the case, like you just said. You see, we have all the various parts of Accra. If we really had a lot of research funding, sometimes what could happen is that you could map Accra and see where all the various cancers are coming from. Then you can draw that link with them. But the other ENT pathology that we would usually find with some of these are in some of the cement producing areas or some of the areas that have a lot of factories. We find that if you get a patient with usually nasal polyps, which are inflammatory, those are not cancerous. When the patients come from those areas, usually they come with very extensive disease, and managing them is sometimes a big challenge. The other carcinogens that we found of essence are some of the artisans who handle hydrocarbons. So they may come in with laryngeal cancers, so they wouldn't have smoked cigarettes, they wouldn't have had anything to do with any other risk factor that we would have been expecting. But when you delve in, you find that they've been exposed to like hydrocarbons, mixing chemicals, working on car engines, inhaling those ones. So if actually